Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Sojan George K., gastroenterologist at Amala Medical College, Thrissur, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussions.
Hello, everyone. It is nice to be having a friendly chat with each and every one of you. I am Dr. Sojan George K., Professor and Head of Department of Gastroenterology, Amala Gastro Center, a unit of Amala Institute of Medical Sciences. I head the department's luminal gastroenterology team as well.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
IBS is actually a cluster of symptoms. Patient can present to you with varied symptoms like constipation, abdominal pain, bloating and distension, and diarrhea. So this mainly happens due to various reasons. It's almost like your bowels are moving slowly and they are hypersensitive. So if I prick 3 of you with the same needle, all 3 of you would feel the pain differently. It's almost like this. Some of our bowels are very sensitive, and even slight amount of distension and lack of movement can lead to severe discomfort. And this leads to a cluster of symptoms which I would call as IBS.
In your experience, how does a typical IBS patient present in an OPD?
IBS, as I said, is a group of symptoms. So basically, when somebody has IBS, they will be a healthy middle-aged male or a female who comes to you with a cluster of symptoms which includes constipation, diarrhea, bloating, abdominal cramp and discomfort. Many of these patients would be having their symptoms predominantly in the daytime and will have a comfortable time while sleeping. Many of them would be anxious, and often I notice that they come to me in my OPD with a pile of papers which have been their previous consultations with various other doctors. So this would fit into a garden variety IBS in my opinion.
What simple screening questions can a consulting physician ask to suspect IBS?
Gone are the days when IBS was considered to be a negative diagnosis. That is, you rule out every other disease and diagnose IBS. Nowadays, it is a positive diagnosis, and we go by something called as a Rome 4 criteria for diagnosis of IBS. So basically, we ask for positive symptoms, which include a recent change in the bowel habits, be it either constipation or diarrhea, a difficulty in passing stools or need for abnormal straining, whether the patient feels bloated, whether his symptoms are more after taking food, and whether he feels comfortable after a defecation. And the final question would be to look for warning signs, and the most common among them would be looking for symptoms at night. And if the symptoms disturbs the sleep, I would rather consider it diagnosis other than IBS. But if my other questions are supported, I would come to a positive diagnosis of IBS.
Are there any warning signs where a physician should immediately refer to a gastroenterologist?
It is essential to know when the condition could be something beyond IBS. So basically, we look at a set of symptoms which are called as red flag signs. When somebody has bleeding per rectum, it should never be diagnosed as IBS, and you need to work up them further. Somebody with an abdominal lump, significant abdominal pain, especially one which wakes him up from sleep, when he has a weight loss of appetite, or what is otherwise called as anorexia, a strong family history of malignancy, all these should make you suspect that he can be having something beyond IBS. And these are the set of symptoms where an immediate consultation with a gastroenterologist has to be taken and probably investigated further to have a confirmatory diagnosis of IBS.
Once IBS is diagnosed, what is your first line approach to management?
As I said, IBS is not actually a disease. It is a group of symptoms which arise because of something which is normal to your body. So, a hypersensitive gut, a decrease in bowel motility. So, the best thing to do would be to change your lifestyle. If there is something which is a precipitatory factor, something like stress, your dietary habits, all of these would need modification. So I reassure my patient as soon as I come to a diagnosis, because most of these patients would be actually coming to you with the fear that they have something significant, especially a malignancy inside. So I take some time to reassure them, give them diet and lifestyle modifications, the most important of which is asking them to drink plenty of water and to exercise daily. Then I make sure to instruct them to follow a food diary and avoid foods which cause precipitation of their symptoms. Most often, I find that many of them would be having an increase in symptoms when they have consumption of dairy products or something which contains plenty of items which contain FODMAPs, which I will be dealing with later on.
What's your opinion on the role of rifaximin in IBSD? Where does it fit best?
I think IBS fits perfectly into the diagnosis of a functional group of symptoms. So, when somebody has IBS and if diarrhea is a predominant symptom, something which has worked like magic for us is actually rifaximin. So, if you look at rifaximin, how it works is mainly by cleansing the bowel bacteria. So, rifaximin helps in patients with diarrhea predominant IBS, where it cleanses your bowel, and I often couple it with a probiotic which repopulates it with good bacteria, and I have significant symptom relief when it comes to patients with IBS diarrhea.
How do you handle a patient who doesn't believe IBS is real?
I think the key to making a positive diagnosis and to symptom relief in a patient who doesn't believe that IBS is real is basically speaking to the patient again and again. Positive reassurance, giving them real life examples would be the best way to confirm this patient, and speaking to him in terms which he can understand would go a long way in helping him to confirm his diagnosis of IBS.
What are some practical ways physicians can build patient trust in IBS treatment?
As I said earlier, why many of the patients with IBS are confused is because they go around different doctors. Most of them worried to make a diagnosis of IBS because they all suspect that they are missing something more important, and hence patient gets the belief that the doctors are not capable of coming to a diagnosis to him. So sitting with the patient, speaking to him, reassuring him, going by a standard diagnostic criteria, keeping the patient in the loop, and coming to a clinical diagnosis would be the best way forward.
What's your message to young doctors who hesitate to label a case as IBS?
When I'm asked with this question, I would like to look upon my days as a gastroenterologist earlier on when I was worried whether I am making a mistake by labeling somebody with IBS. But as years have gone by, my diagnosis of IBS has become much more clear, and most often, almost like 98%, I always end up in the correct side. So why it is important to come to a correct diagnosis of IBS is because if you do not do that, patient will keep on searching doctors. They will have many unnecessary investigations which are done on them, and all of these would result in unnecessary loss of money as well as time and increase the anxiety of the patient. So it's always essential to diagnose IBS because this is one of the most common reasons why patients come to you.
How can physicians and gastroenterologists collaborate better for early IBS diagnosis?
Constant dialogue would be the key. So there need to be much more interactions where they can be discussing difficult cases. Have always a gastroenterologist friend with you so that if you are confused, if you have an alternate diagnosis, if something looks strange, always refer to them. But I think like IBS is not something which can be managed only by a gastroenterologist. So I think like learning the room for criteria, coming to a positive diagnosis Having a constant consultation with your fellow gastroenterologist whenever there is something suspicious and getting a scopy done in patients who have red flags would help in better collaboration among physicians and gastroenterologists.
One food you tell IBS patients to avoid?
Now, there are various diets which would help patients with IBS. The best way out, if you ask me, would be to follow a food diary. It is not easy for an average Indian to follow many of the diets which have been prescribed for IBS because our foods always contain plenty of things which are needed to be avoided in patients with IBS. So basically, I ask my patients to keep a food diary. Whenever they have symptoms, I will ask them to note down everything they have had prior to that, maybe for 6 to 8 hours. When symptoms keep on repeating, I ask them to go back and have a look. If the same food is consumed every time they are having symptoms, I ask them to avoid it. But if a patient comes to me and asks me like what food should I avoid, probably the first thing that I would ask them to avoid is milk, because that is what I find most of the patients have exacerbation on when they consume it.
One word that describes a typical IBS patient journey?
I think it would be actually a roller coaster ride to describe the word or the journey of an IBS patient. They will be having on days, off days, when they are having full of symptoms, when they are totally free of symptoms. But I think that is also the key. If the patient can follow him up closely and identify what are the things which are likely to worsen his symptoms, I think that would be the best way out and help him to maintain a healthy lifestyle which suits him the best.
What's your gut-friendly morning habit?
I think my most gut-friendly morning habit is to drink plenty of water as soon as I wake up and having a morning stroll, because both of these would help me. I'm a pious sort of person, so basically attending my daily mass also helps me a lot. So basically, you need to do something to relax yourself. Drink plenty of water, have regular exercise, relax yourselves. You can take up yoga, which is a very good form of exercise which helps to relax your mind and body. Simple walking would also go a great way in having symptom relief. It was a pleasure talking to each and every one of you. Thank you so much for your patient listening.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.